Welcome back, parents. We're doing session 4 today of our There's Ups and Downs of Parental Wellness series. And this one is one that's going to be very popular with lots of you because it's about understanding problem behavior. So for the next couple of videos, we're going to be talking about problem behavior because we know that that's a massive source of stress for a lot of parents of kids with Down syndrome. So before we jump into that, let's start in the way that we usually do. And that's with our mindfulness practice. So today, keeping in mind that we're going to be talking about problem behavior, which often brings up loads of, frustrating, angry sorts of thoughts for parents. That's what we want to kind of talk about today or address today with this one. So this kind of mindfulness meditation helps us to accept or just be with some of those negative emotions without getting too caught up in them. So it basically helps those emotions subside in a more healthy way. And it's meant to be done when you're currently experiencing really negative emotions like anger or frustration. But, I'm also hoping that just thinking about problem behavior may have already brought up some of these feelings for you. So if you can think about a frustrating situation that you've had recently with your child, that would be helpful here. Or just, the fact that we're still in the middle of a pandemic right now, that might also bring up some negative emotions. So if you can't think of anything though, don't worry about it. Just kind of keep this one in your back pocket for the next time you are experiencing these kinds of emotions. So we're going to start in the usual way that we've started the last couple of times with this sort of how we started the sitting mindfulness practice. And then I'm going to lead you through what's called a compassionate abiding practice. And so as we begin, we're just going to get comfortable in the usual way. You can close your eyes or gaze downwards with a soft focus. Feet flat on the floor, arms resting on your lap in a comfortable position. And start with just a couple of deep breaths to relax you and help you settle in. Once you've done that, you can let your breathing return to normal and bring your focus and your awareness to your breath. You can count each exhale until you arrive at 10 and then begin again at 1. And so staying in this present moment, acknowledge that you are troubled by something. Maybe a situation that's provoked feelings of negativity or anger. Could be an interaction with a family member, maybe one of your kids, a friend, a coworker that just didn't go well, or some other relationship that causes you some frustration. And now try to attend to this emotionally intense, negative or angry feeling. Breathing in, allow the feeling to be with you and open up to it. Inhale deeply again and relax with the feeling without pushing it away. And while still abiding with this feeling and the urge to respond to the anger, which may come up, relax as you exhale and give the feeling a little bit of space. Loosen the tension surrounding it. Abide with the negativity with compassion rather than responding to it or pushing it away. Basically treating this feeling like we do the breath with non-attachment. Don't grab onto it. Don't push it away. Just be with it, abide with it, sit with it. Don't reject or indulge the feeling, but view it without judgment. And stay present with this feeling, breathing in and breathing out until the negativity and anger dissipate. And just do this for a few more seconds, breathing in, breathing out, until the intense negativity dissipates. And as we come to the end of this practice, try to take this process with you and perhaps go through it the next time you are actually experiencing feelings of anger, frustration, or negativity. You can gently open your eyes if you happen to have them closed and have a little stretch. So now, with that in mind, our compassionate abiding practice being done, let's move on to our topic of this video, which is talking about why problem behavior occurs. So today I'm going to be arming you with some knowledge that will hopefully help you have more perspective and more know-how so that you're better equipped to deal with tricky situations as they arise. And then next session, we'll be talking much more about what to do about it. So the framework that we're going to be talking about in terms of addressing problem behavior, understanding and addressing problem behavior, is called family-centered positive behavior support. And this is a really well-backed through scientific method for both the approach for the assessment and intervention associated with problem behavior. And the overarching goal here is to make meaningful and durable improvements in your child's behavior and in your family's quality of life as a whole. And that includes your stress levels. So hopefully bringing those down. And so this is basically based on many different, this approach is based on many different scientific, it has a lot of scientific backing. Lots of theories are involved in this. So one of them is the principles of applied behavior analysis. So this is referring to the fact that behavior is lawful. There are laws of behavior that follow for everybody. Doesn't matter whether you're a kid with Down syndrome or their parent. It definitely, these laws apply to everybody. There's ecological and family systems there. Theory involved, normalization and inclusion, person-centered values. And the goals of it for both child and family, it's kind of equal parts. For the child, obviously, we want to reduce problem behavior, but we also equally want to increase adaptive behavior. So this is, skills such as skills of daily life or communication, increasing successful participation in family routines, right? And then for the family goals, we definitely want to look at strengthening relationships among family members and the family system itself. So it aims to address all of these things. So just to be clear here, as we move into problem behavior, talking about why it happens, I just want to be clear that this slide is not an example of problem behavior. I just thought we should look at something really cute and fun before we get started on such a serious topic. So how we're going to do this is we're going to talk first about behavior as it applies specifically to kids with Down syndrome. And then we're going to move into the laws of behavior more generally, because it's not just kids with Down syndrome who behave problematically. Actually, we all do. So without further ado, let's talk about kids with Down syndrome specifically. So in case you hadn't noticed, your kids are pretty complex, right? Sometimes it's just the behavior, and we're going to get to that, but sometimes there's more going on. And I just wanted to quickly cover that for a couple of minutes. So an estimated 30% of kids with Down syndrome have a significant behavioral issue that warrants an additional diagnosis. And beginning in childhood, these are the things that you see in this list. And I've bolded and underlined autism because, of course, we see that quite frequently in the kids at DSRF. Not just at DSRF though. There's lots of, all kids with Down syndrome, no matter where you are much more likely to have a diagnosis of autism. It's upwards of, probably about 15% at this point will have this additional diagnosis. And then that 30% of kids who have an additional behavioral issue that warrants diagnosis, that's about 3 times higher than for typically developing children. So the thing is, though, that lots of times problem behavior is just that. It's just problem behavior. But the problem here is that they still really struggle, and it still really interrupts the child's ability to participate in the routines of everyday life, right? So academics and things you need to get done at home and their social time, the behavioral challenges get in the way somehow. So I'm not going to go into in a longer talk. I might go into some of the brain differences that cause this. If you are interested in this sort of thing, I can give you some resources, or you can email me about that. But what you really need to know are some of the consequences of the brain differences. So the fact that there are structural and functional differences in the brains of people with Down syndrome, and that results in all of these things in this list. So one being the reduced ability to process information, especially as it's coming through auditory channels. So if you don't understand something that's going on because somebody's been talking to you about it, that might increase the likelihood of problematic behavior. A big one for me, and I've bolded it here because it was a real aha moment for me when I first learned about it, is that kids with Down syndrome tend to have decreased levels of overall intrinsic motivation. So this is sort of your internal drive to get up and go. And kids with Down syndrome tend to lack that a little bit. So this means that, if you think about your levels of intrinsic motivation varying from day to day, some days you wake up and you have lots of it and you get lots of stuff done and you're raring to go right from the get-go, but other days you don't feel so great and you are tired and your energy is low and you just can't seem to make yourself do stuff. And it's that second scenario that may be going on for your kid with Down syndrome all the time. And so I think it's just helpful for us to keep that in mind and remember that everything is a little bit harder for them. And that's really the basis of a lot of the behavioral strategies that we find work best for kids with Down syndrome, is about making things less hard. So that's a really big one to keep in mind. Problems with executive functioning. So basically, this means that they're less, they don't have as much ability to plan their behavior in advance. They may be more impulsive. So this looks different for every kid. So some kids will bolt, some kids will hit impulsively. Most kids with Down syndrome will say no every time you ask them if they want to do something, even if it's something they really like. So that's a really common scenario. Memory problems, so they have trouble retaining and then being able to draw on information that's in their brains. That means they need a lot of repetition and review. And then hyper awareness of other people. We've talked about this one already, that they have increased empathy. It does have a downside too, though, in that they tend to be a little sensitive, oversensitive to the emotions of others, and that can be really problematic for behavior. So let's think a little bit more about behavioral characteristics of these kids in specifically. So another thing that happens is that during cognitive work, kids with Down syndrome show lower levels of task persistence. And this is even for things that are easy for them. So, it's not just really hard tasks. They don't tend to have like I'm going to stick to it till it's done. This is actually even easy tasks that they can do. They tend to give up a little more easily than other kids. They also, and this likely won't be very surprising to most parents of kids with Down syndrome, have higher levels of off-task behavior. So basically, this is overuse of social skills, right? Or party tricks. And that's what the researchers actually called this. So basically, this is making a silly or cute face or a funny noise or pretending to pose for a photo. So before I read about this in the research, I used to refer to this as the ham effect. So ham being like somebody who's cute and charming and able to kind of get their way. But it actually has been documented in the research literature. And even though it's hard, I would urge you to not fall for the ham effect, especially when you're trying to get something done. This doesn't mean that you can't be silly with your kids, because we know that kids with Down syndrome are really big fans of being silly, but it needs to be adult directed rather than child directed. And there's a time and a place for that silliness. And getting ready in the morning is not one of those times. So we'll be talking about that more next in the next video. So I was going to share with you as well. I think it's important to note that not all behavior in kids with Down syndrome is charming, right? There's definitely some quite serious behaviors that go on that are really can be very unsafe, can be really frustrating for parents. And I thought you might just want to think for a minute first. I'll grab a little sip of water. Think what the most common ones are that might show up. There was finally a study that was done quite recently that showed that 94% of kids with Down syndrome engage in problem behavior, at least one kind that is very irritating for their parents. I'm sure, again, nobody here who's listening to this video is surprised to hear that. But guess what some of them are? What might be the most common behaviors? So here they are. Let's see if you guessed them. Wandering away from adults, non-compliance. So in other words, in varying forms, not following through with adult instructions. Sitting down and refusing to move, or as parents like to refer to this, the drop and flop, and aggression. Those are the four most common types of behaviors. And I'm sharing this with you not because I think you need help like convincing you that all of this is true, but what I do want you to take away from this is that it means that your kid is not alone. And I think sometimes parents might feel like they're alone in dealing with problem behavior, but you're definitely not. So let's move on now to talking about more the general context of behavior. So I was talking about how behavior is lawful. And so we're going to talk about that more now. So the context surrounding problem behavior is really important to think about, not just the problem behavior itself, but what's happening around it at 3 different points in time as well. This is called a 4-term contingency. Contingency essentially means that problem behavior's occurrence is contingent or dependent on other things happening or not happening. So in order to really get at this, I'm going to take you through a little bit of a story so that you can have something kind of think about, an example to think about while we go through these. So Elise is a delightful, playful 4-year-old girl with Down syndrome. She lives with her mom, dad, and 7-year-old sister. She loves playing with her dog, watching Paw Patrol, and dancing around the living room with her sister and dad. I don't know why mom doesn't get in on the dancing, but she doesn't. Poor mom. She is in good health, but is a picky eater, and on some days she eats very little. Lately, around bedtime, she has been engaging more and more frequently in some problematic behavior. When her mom tells her it's time to put on her pajamas, Elise begins to whine, saying, "No bed." If her mother persists, she starts giggling and rolling around on the floor. Mom then has to try and wrangle her flailing body into bed, which does not always work because doing this often hurts mom's back. If mom leaves Elise, she remains quiet in her room until she falls asleep on the floor in her clothes, but that can take a couple of hours. And this is all more likely to happen on days when dad is working late. So let's talk about this, and then we're going to get back to Elise in a few minutes. So we've got to look at these other points in time, as I said. So one thing to look at is a setting event, which happens before or simultaneously with the problem behavior. The second thing is the antecedent, which is the thing that happens immediately before the problem behavior. Another word for that is the trigger, the direct trigger for problem behavior, the problem behavior itself, and also what happens right after the problem behavior. So let's look at setting events first. So there are two main types here. We can have ones that happen before the problem behavior, or ones that are kind of always around, but not really easy to spot. So there is not always a setting event at play. And even if there's one present, it doesn't mean that the behavior will occur. It doesn't directly cause it. What it does do is make the problem behavior's occurrence more likely. It sets the stage, so you can see the picture of the stage there. It sets the stage for problem behavior's occurrence. So these are typically physical or emotional states that make the problem behavior more likely to occur. So your own kids aside, lots of you will know what these things are for you. So think about, if you have a problem behavior of not getting enough work done during the day and not finishing your work, and not being able to stick to it, likely there's a setting event at play. And that's likely something like you don't feel well, or you're tired, or you didn't pack a big enough lunch, or you packed too big of a lunch, right? It can be all sorts of things. So the most common ones for your little dudes and dudettes are these, okay? So physical illness, fatigue, hunger, lights that buzz, too much noise is a big one. Another huge one is lack of peer or parent attention. That's a very common setting event. Behavioral history. So this is something happened earlier in the day that's now set the kid up to engage in problem behavior. So a classic example of this is a child already did 3 hours of reading at school, and then mom asks them to do reading at home. They're not going to be very likely to comply with that. You will likely get some non-compliance type behaviors. Skill deficits, which we know all kids with Down syndrome have in terms of language, speech, social, their motor ability, those also count as setting events. And then environmental characteristics. And one example of this is from a little girl in my study that I did who was having trouble feeding herself at dinner. And turned out she was very distracted by this big, beautiful chandelier that they had in their living room, in their dining room. And so, turning that off sometimes when she was too engrossed in looking at it turned out to be a good idea, but that set her up for, not eating and not feeding herself. So antecedents then, now we're talking about the immediate trigger for problem behavior. So this is the event that happens immediately before the problem behavior happens. And here, this one is necessary for the problem behavior to occur. So the problem behavior will not occur unless the antecedent happens first. It can be a little tricky for parents to identify, but most parents, if you ask them this question, what's the one thing I could do to make the problem behavior occur? And most parents will be able to name at least one or two things there, right? If I really want my kid to start screaming, what do I do to them, sort of thing. Okay, so in this photo example, you can see that the little girl's shoelace is untied. This is representative of a setting event. So this makes it more likely that she's going to fall, that she's going to trip and fall, but she could walk around all day and never fall because she needs the trigger for the behavior to occur. So she essentially needs to step on that lace and then she'll fall. So the setting event is the untied shoe, but the trigger is her stepping on the lace. So hopefully that makes a little bit more sense. So some common antecedents, especially for your kids, are things like denial or removal of a preferred activity or item. So this is essentially, it's time to put the iPad away now, right? Or taking it away, or saying you can't have goldfish crackers right now, that kind of thing. An onset of an unpleasant situation. So this would be for a lot of kids setting foot in a grocery store. You know, it's loud, it's not very fun in there for most kids, and they just don't really like it. So it's unpleasant, and that may trigger problem behavior. And then a demand is the other thing, and that's the really big one. And when in the next video, when we start talking about helpful strategies, we're going to talk about how to modify your asking of demands of your kids, so that hopefully they don't engage in so much problem behavior. So you guys, I'm not going to go through each of these, but if you want to look at identifying, if you want some practice in identifying what the antecedent is, you can look through these two examples on this slide. So problem behaviors then, obviously this is the problem behavior itself. So now we're at the third point in the four-term contingency. What we want to do here is carefully define what the behavior looks like. We need to give a really clear description, including intensity and frequency if possible. It's important to be able to describe the behavior so that anybody can spot it, right? Because oftentimes we're talking about not just parents, but school teams as well. You're in a better position then to be able to pick out all the other contextual events in the puzzle that are occurring if you can accurately identify the behavior. The other thing we want to avoid here is giving this subjective label. So we don't want to say things like stubborn, right, which is a bit of a subjective label, or, you know, he just ignores me, which is again a little bit of a subjective label. You want to try and describe it clearly instead. And here are some examples of doing that. I'll pick out just the doesn't listen one, because that is one that's true of a lot of kids with Down syndrome, but it looks different for a lot of them. So for this kid, it does not respond to instructions within 30 seconds. For another kid, it might be turning away from mom or dad. And for another kid, it might be saying no, right? So you want to be really specific about that. The consequences piece then, this is what happens immediately after the problem behavior. And we really need to closely examine exactly what happens at that point in time, which can be difficult to do as well. And it may surprise you, because the consequence, which is sometimes mistakenly interchanged with the word discipline or punishment, and be careful not to do that, because that's not really what we're talking about here. It may surprise you. So what is happening after the problem behavior sometimes doesn't, if it's a consequence that's done by the parent, it sometimes doesn't have the effect that you intended. So that can be pretty frustrating. So this is a really crucial piece of the four-term contingency for assessment and for intervention as well, because it allows you to determine the function of the behavior, which is what we're going to get to next. So, you know, and just a little bit more about that, you know, that the consequence sometimes doesn't match up with, you know, it doesn't align with what you were trying to do. If a child is not doing his homework properly, and maybe he's, you know, ripping up the page or scribbling on it or something like that, and you send him to his room, that's what happens after he engages in that problem behavior, then that's not a consequence that's going to reduce the likelihood of that problem behavior in the future. And in fact, it will increase the likelihood that your child will do those things. And the reason why is because you've given the child what he wants. So you've basically allowed him to avoid the activity, escape from the activity. So that's why we need to be a little bit careful about this here. And, you know, the other issue that comes in here is the same consequence can't be applied after all behavior. So there's a big difference. If you look at this little guy in the picture here, who looks like let's say dad has just picked him up. Okay, and he doesn't look very happy. Dad is obviously trying to comfort him a little bit. There's a very big difference between dad picking him up and comforting him if that little guy just fell and, bumped his knee or hurt his head, or, he's hurt in some way and he was crying because of that. That is okay. If dad has picked up this kid and is comforting him after the kid has stomped his foot and said, no, I'm not leaving the park, and this is how dad is now going to get him to leave the park, that is now not an appropriate consequence. So this is what we have to think about a little bit. And it is tricky to wrap your head around for sure. So if you look at this one again, let's now talk about, I'm going to take a sip of water and I'm going to give you a minute. I want you to think about what are the setting events, what's the trigger for Elise's behavior, what is the behavior itself, and what's the consequence of her behavior. Okay, so let's start with the setting events. The setting events, the things that set the stage for Elise to engage in problematic behavior, but don't necessarily cause the behavior itself, is that maybe she didn't eat enough that day. And then the other one is maybe dad is working late and it's just mom at home. So those are the two setting events. The immediate trigger is mom saying it's time to put on your PJs. So this is a demand, right? And we just talked about how that's a really common trigger for problem behavior in kids with Down syndrome. There's a bunch of behaviors here. If we're going to objectively describe them, we're going to say things like whining, saying no bed, giggling, rolling on the floor, and I think that was about it. The consequence most of the time is that, mom kind of fights with her a little bit or leaves her alone. But the overall result of this problem behavior is that Elise does not go to bed. And so that's what we want to kind of leave it at there. The big consequence here, the big result of everything is that Elise doesn't go to bed. So let's get into functions now. So, this is where you parents are going to be able to figure your kids out a little bit. Okay, so it's all fun and games until someone figures out the function of your behavior. So what the behavior looks like is actually not that important to this process. You have to figure out why the behavior is occurring in the first place. And so we always hear people talking about how they want to stop temper tantrums, or how do I get them to stop swiping the table and like everything lands on the floor. Instead, we want to talk about the function way of thinking. So, she's basically engaging in, instead of saying he's having a temper tantrum, we might say he's engaging in attention-seeking behavior. So that's the reason why. And that way of thinking will help us figure out better what to do about the behavior. So some good news here is that every behavior has a reason behind it. And this is not something that is really intuitive, because lots of parents and teachers and educational assistants and therapists will say, I don't know where it came from. He just all of a sudden hit me. Right? So contrary to popular belief, they don't usually come out of nowhere. There are some behaviors that are truly impulsive, but oftentimes there is a trigger for the problem behavior. That's in fact, most of the time there is a trigger. And then the other piece of this is that even if the behavior doesn't make sense to you, like, why is my kid, taking a little piece of paper and flapping it in front of his face all the time, and I can't get him to pay attention to me? It actually does make sense to your kid. In their world, the behavior is logical and it's purposeful. And we know that because otherwise they wouldn't do it. So here are the functions of behavior. There are only 4 of them, so that makes our job a little bit easier. They are attention, escape or avoidance of tasks. Tangible refers to something you want. So Basically, this can be either an actual object or a food or something like that, or a toy, but it could also be an activity or an event, and then automatic reinforcement, which is a little bit different. We'll get to that one at the end. So attention, we're going to go through each reason why problematic behavior may occur. And then we can talk about some examples as well. So attention, the message here that kids are trying to give is, Mom, look at me. And we know that problem behavior, especially in kids with Down syndrome, often occurs because the child is trying to get attention, either from peers or from mom and dad. Or siblings, right? So it can be positive attention, of course, but it can also be negative attention. So when you don't get a lot of attention from others, or you feel like you need more of it, any kind of attention will do. So this means that we have to be really careful about giving kids negative attention as well. And this is even saying things like, stop it, don't do that. Right? Times when you think you're going to curb the behavior, you may actually be increasing it by accident, right? So those party tricks I was talking about earlier are at least partially to get attention. But in terms of the negative attention, I thought I'd just give a quick example of a young man that I worked with when he was younger, and when he was in about grade 5, he all of a sudden started pulling his pants down in the bathroom at school. And he was a kid now, so by grade 5, kids with Down syndrome don't get as much attention from their peers anymore. Their peers have kind of moved on and they're into other things. And so in order to get a reaction from them, even though it was what we would consider a really negative reaction, he would pull his pants down in the bathroom with other boys around. So that's just one example. That's something that definitely tends to happen a lot at school with kids with Down syndrome, for sure. So here are a few examples. A girl cries at bedtime until dad reads her a story. A 5-year-old unravels the toilet paper all over the living room while mom is cooking dinner and then says, ta-da, and mom becomes very upset. There's your negative attention. A girl sings Let It Go at top volume while her mother tries to place the family's food order at White Spot. Mom gives her a stern look, but the other patrons think she's cute, so they smile and laugh, and we all know what happens after that. There's a whole lot more singing. So let's move on to our second function, which is escape. So the message here that your child is trying to give you through engaging in these behaviors is, I don't want to do this, whatever it is, or I don't want this object or this food, or this is too hard message, or this is too long, this is too boring, this is too something. And it's really common for kids to behave problematically to get out of doing something. It could be a complete end to the non-preferred activity or just a bit of a delay, right? So if I act a little bit goofy for a while, I don't have to do the math, and then I'll maybe do one question, then I'll act a bit goofy some more, and I don't have to do it again for a little while. So both things can happen. It can also be a complete avoidance of the activity altogether, right? Like you don't even get started on it because of the problem behavior. It's also the function at play during the dreaded transition. We know that kids with Down syndrome are notorious for having trouble with transitioning between one activity to the next. And this is exactly the function at play there. So after talking about all of that, I also talked about earlier the lower levels of task persistence, right? So that's what this is. I'm not going to stick with the activity. I'm going to escape from it. So what we're talking about here essentially is that most of kids with Down syndrome's problem behavior is due to wanting to escape something or wanting attention. Those are the two biggies at play. So there you go. I've given you a big hint and a head start already to figuring out your own child's behavior. So here are a few examples. A 3-year-old squirms and whines during teeth brushing. Dad gives up and lets him off the hook. A girl crawls under the table during her speech therapy session. The speech therapist can't get her to come out for 10 minutes or maybe the whole session, which has happened to me. A boy scrambles upstairs and hides as soon as his dad shows him his coat and says, let's go pick up your sister. Dad is very late picking up his daughter. So there's an example of a delay in an activity. This might look familiar to a lot of you as an escape-driven behavior that might be happening on the way to school in the morning. Might look familiar. The third one is a tangible message. So here, or function, the message here is I want something. So last one was I don't want something. Now we're into I want. So here's a big list of things that kids could possibly want. This happens when a child wants something that's physically inaccessible. So that might be cookies or crackers that they like that are up on a shelf that's too high for them to reach. Something that's currently unavailable. So maybe mom says, you know, you can have a cookie, but you have to wait until your homework's done. Or something is taken away. So the child has gotten a hold of the bag of cookies, but mom says, no, you can't have that right now. We're gonna have dinner soon, right? So any one of those, I'm sure you can tell, might conceivably cause problem behavior to occur. So here are some examples. Specifically, a boy grunts and yells while looking at a box of goldfish crackers on the counter until his sister gets it for him. A 4-year-old drops to the floor of Safeway and yells when her mom says, sorry, no cookies today. Mom sighs heavily and says, okay, but you can only have half a cookie. Now please get up. A girl whines when her dad turns off the TV so she can get ready for church. He turns it back on and says, okay, just 2 more minutes. So you will notice that in each of these examples, the problem behavior resulted in the child getting exactly what they wanted, or at least part of what they wanted. So that's where, again, we got to pay attention to those consequences, the result of problem behavior. The last function we're going to talk about is automatic reinforcement, which is quite a different one, actually. It's not a socially mediated function like the last 3. Socially mediated basically meaning that another person is involved. So you need someone to help you, get cookies on a shelf or give you a demand so that you engage in problem behavior. These are sometimes referred to self-stimulatory behaviors. And a big misconception here with these is that this is just an autism thing. It's just kids with autism or kids with this dual diagnosis of Down syndrome and autism that have these behaviors, but that's actually not true. Loads of kids with Down syndrome engage in these behaviors on a regular basis. Examples, we all do these actually to some degree. It's just that a lot of us are better at, only doing it in a more socially appropriate way, or we tend to do them when we're alone, right? That kind of thing. Hair twirling, like this woman here, is a very good example. Biting fingernails, playing with jewelry. If I have a necklace on, I will often play with my necklace. Chewing on your lips, even scratching to remove an itch is an example of an automatic reinforcement behavior. So these are essentially internal states that you either want to achieve because they make you feel good, or you are trying to correct something. So you are too aroused, so you need to calm yourself down, or you're really kind of low energy and you need to wake yourself up. And that's often what's happening. So doing these make us all feel better, including kids with Down syndrome, but there's no other person involved. So here are some examples that are quite common, I think, in kids with Down syndrome, in my experience. So a 5-year-old vocalizes to himself, so kind of like a droning kind of vocalization when he's feeling tired. A girl chewing on her thumb during hard tasks, and a boy who's rubbing and crumpling and ripping paper repeatedly when he's bored or tired. So let's go on to this, which is our friend Elise, who we talked about earlier. Here's the whole thing, okay? And the function of her behavior, the do not going to bed, she escaped the activity that she was supposed to be doing. Or you can phrase it as she escaped the demand that mom gave her. It's time to put on PJs and go to bed. Okay, so that's essentially what's happening there. So make sure that you look at that story again, maybe, and understand why each of those components fits where it does, because that'll go a long way to helping you figure out your own kids' behavior. And that's about all I have for today. Next week, as I said, next video, we are going to start talking about what to do about problem behavior. So stay tuned for that. In the meantime, try to figure out what it is that your little person is doing. Their setting events, the things that trigger their behavior, the problem behavior itself, and then the consequences, and then see if you can figure out. There's probably more than one function going on, honestly, a lot of the time, but you can probably also start to piece together which functions might be most at play for your particular child. So thanks everybody for watching this video, and take care.